Class is now starting. All attendees are in listen-only mode.
Hello everyone and welcome to today's Health Educations webinar. My name is Christina Roque and I am the Health Educations webinar coordinator. Today's webinar is Know Your Medication. Today's health educator is Patty McKenzie. Patty is a registered nurse and a certified diabetic educator. She currently works for Beaver Medical Group as a health educator. She has presented to many groups on a wide variety of health topics and will be presenting today's webinar. Welcome, Patty.
Thank you, Christina, and thank you so much for joining us today. As mentioned, today we'll be talking about diabetic medications. The more you know about your medications, the more you become a team player in your own health care. So let's start with a few brain teasers. All diabetic medications work the same way, true or false? And that is false. There's many different medications available to you, and they all help manage your blood sugars in different ways. Next one, I will eventually have to start on insulin. True or false? This is also false. Not everybody will need to start on insulin, but if you need to start on insulin, it's a good drug. Okay. And last one, if I start on diabetes medications, I will not have to follow a meal plan. True or false? Again, this is also false. Following a meal plan is very important in controlling your diabetes. All right. When we eat our foods, this is where our energy comes from. The energy in the food, so here we're eating an apple, it's coming down, body's digesting it, and it is absorbed into the bloodstream as blood sugar. Okay. The glucose travels through the blood into the body's individual cells with the help from insulin. So you've got your little blood sugars, are these little blue dots, and this is your insulin. They're the little keys that are going to open up the cells. Insulin opens up the cells to allow the glucose to enter, and then it's converted into energy. Sometimes we eat more food than we need, so the extra glucose is stored in the liver and fat cells. The liver has many functions, as you can see here, but the one that we're going to be dealing with is it also releases blood sugar when your blood sugar starts dropping. So it also helps regulate your blood glucose. Meal planning and exercise play an important role in controlling your diabetes, but sometimes this is not enough. Your doctor will then prescribe medications based on your A1C levels. Remember, it is still important to follow a meal plan and get plenty of exercise. Diabetes pills are simply another tool to help you manage your blood glucose. So, diabetes pills work in several ways and in different parts of your body. This chart shows some where the most commonly used diabetic pills work. Your doctor has many options to choose from, and you might be prescribed 1 to 3 different medications, depending on your A1C levels. We'll be looking at some of the most commonly used diabetic medications. And the first one is Metformin. It is the most commonly prescribed medication for diabetes. Metformin works by helping to restore your body's proper response to insulin that you naturally produce. It also decreases the amount of sugar that your liver makes, and it delays the absorption of sugar into the intestines. Metformin is taken with meals to help prevent some of the more common side effects of the medication: nausea, diarrhea, stomach discomfort, gas, and heartburn. And if you are on metformin, you will need to limit your alcohol to 1 to 2 drinks a week. The next class, sulfonylureas, which include Glyburide, Glipizide, and Glyburide, they are the oldest of the diabetic pills available. They were first developed in the 1940s and were the first of the diabetes pills to enter the market. They help your pancreas make more insulin. Hypoglycemia is a common side effect, so make sure that you're taking it with a meal to help prevent it. I'm not even going to try to pronounce this, but we're going to call them TZDs, which include Actos and Avandia. These medications help lower insulin-resistant cells, improving the way your body responds to your insulin. They also reduce the amount of glucose produced by the liver. You can use them alone with other diabetic pills or with insulin. Some of the common side effects are weight gain, fluid retention, headaches, muscle pain, runny, stuffy nose, or sore throat. If one experiences any side effects, particularly sudden swelling, weight gain, or difficulty breathing, make sure you notify your healthcare provider immediately. This next group of drugs, which include Januvia, Onglyza, Tradjenta, and Nacina, help stimulate the production of insulin when your blood sugar rises, for example, after eating. They also stop working when no insulin is needed. So when you don't need insulin, these medications aren't working. They're just in your system ready to go when your blood sugar rises again. They decrease the amount of sugar released by the liver, and they also slow down digestion and decrease your appetite. The side effects include things like nausea, diarrhea, stomach pain, flu-like symptoms, and low blood sugar, especially when used with other diabetic medications. The next group are fairly new class of medications for diabetes. They include Jardiance, Invokana, and Farxiga. These medications help lower your blood sugar by helping the kidneys get rid of glucose from your blood through the urine. The side effects include genital yeast infections for men and women, urinary tract infections, increased urination, dehydration, and urinary discomfort. Make sure you drink plenty of water with these pills to help prevent the side effects. And if you are experiencing any of them, you need to call your doctor right away so you can get treated for whatever you are experiencing. All right, the next group is called Byetta Trulicity, Bydureon, Victoza, and Tanzium. These are injectable-only medications, and they help you manage your blood sugar by help release insulin when it's needed, prevents the release of sugar from your liver into your system when it's not needed, slows down how quickly the stomach digests food to send sugar into your blood slower, and it may help you eat a little bit less, which hopefully you may be able to lose a little bit of weight on this medication. Side effects include nausea, diarrhea, vomiting, decreased appetite, and indigestion. The last drug that I want to talk about is insulin. With diabetes, your body may not make enough insulin to control your blood sugar, so your doctor may prescribe insulin. Excuse me. The two most common types of insulin to treat diabetes include long-acting, and this is usually what most type 2s will go on first, is long-acting insulin. It starts working several hours after your injection and works for about 24 hours, so it gives you just a little bit of insulin needed in the when your body needs insulin. It doesn't usually cause a sudden low blood sugar. Excuse me. And then we have what we call rapid-acting insulin. This is insulin that you take at mealtime. It starts working right away, about 15 minutes after you inject it, and it's usually taken before a meal, so your body can help. So it will help your body process the glucose that you've taken in your meal. So if you go on rapid-acting, most likely you've also been on long-acting insulin also. And the biggest side effect that excuse me, we're concerned about is hypoglycemia. Excuse me. Hypoglycemia is a low blood sugar below 70. 1 second, please. The chances of getting low blood sugars increase with diabetic medications, and the more you take, the greater is the risk to low blood sugar. It is important to learn to recognize the symptoms and to treat it right away. Symptoms include things like shaky, lightheaded, dizziness, feeling like you're going to pass out. Those are the first symptoms that you usually feel. Headache, hungry, grumpy, irritability usually comes a little bit later. All you need to do to treat hypoglycemia is only about 15 grams of carbohydrates, which include about a half a cup of juice, 3 or 4 glucose tablets. These work really well and they're easy to carry in your pocket or your purse, and about a third a can of regular soda. We follow the rule of 15, which is take in your 15 grams of carbohydrates, wait about 15 minutes, check your blood sugar, and if it's less than 70, then repeat these steps. Usually, treating it one time usually brings the blood sugar up, okay? And if you're getting several low blood sugars in a week, report it to your doctor so your medications can be reevaluated. So you should always educate yourself on any medications that you take, not just your diabetes medications. These include those that have been prescribed, over-the-counter, and alternative medications. Your doctor or pharmacist are good resources. And here's a list of questions you can ask your doctor or pharmacist. A pharmacist is a really good resource because that's what they went to school for. They know all about the medications, and with their computer system, they can plug things in and making sure that all your medications are going to work well together. So you want to know why your doctor prescribed the medication. Is this for my diabetes? Is this for high blood pressure? You need to know what they're prescribing it for. And how many doses do I take per day and what times? Is this only a morning medication? You want me to take it morning and night? Things like that. And how long must I take the medication? Is this something that you want me to take every single day? Is it for 7 days only? Is it a 2-week medication? You want to make sure that you know exactly how long you're going to take it. And you want to know what kind of, how will I know if it's working? And how long must I take it before I notice full benefits? Because remember, one of the medications we talked about, it may take a whole month or so before you really start seeing a difference in your blood sugar. So after a couple pills, you want to make sure that you need to know that it's going to take you a while and not 1 or 2 pills is going to make a big difference. What possible side effects should I look for? If you look, a lot of the common side effects, there's nausea, vomiting, and diarrhea. Those are very common among many medications. And who should I call if they think I'm having any side effects? And should I take the medication with or without food? Should I avoid certain things while I'm taking the medication, like alcohol, sun exposure? Some medications make you more susceptible to sunburns. Any over-the-counter medications that might react with my medication. So there are 10 do's and don'ts that can help make sure that your medications are working safely to improve your health. The 5 do's are: do take each medication exactly as it's been prescribed. Do make sure that all your doctors know about all your medications. You'll see several different doctors for, a heart doctor, maybe an endocrinologist, and your primary care. They need to know all the medications that you're on. And do let your doctors know about any over-the-counter medications, vitamins, supplements, and herbs that you may use, because if they're prescribing something, it may react to something that you're taking. Even though you can buy it over-the-counter, doesn't necessarily mean it will be safe for you. And do try to use the same pharmacy to fill all your prescriptions so they can help you keep track of everything that you're taking. Okay? And do keep the medications out of the reach of children and your pets. The 5 drug don'ts are: don't use medication prescribed for somebody else, and in the other sense is don't give your medication to somebody else. Don't crush or break your pills unless your doctor instructs you to do so. Many medications are designed to start dissolving when it gets into your stomach or later into closer as it's near the end of digestion, so you don't want to break them up and have them start working before they're supposed to. Don't use any medication that has passed its expiration date. And don't store your medications in locations that are humid, too hot, or too cold. For example, like the bathroom cabinet. And don't change your medication dose schedule without talking to your doctor. So in conclusion, Healthy lifestyle choices, including diet, exercise, and weight control, provide the foundation for managing type 2 diabetes. However, you may need medication to help achieve these target blood sugar levels, and sometimes a single medication is effective. In other cases, a combination of medications work better. So thank you for joining me today, and sorry about the coughing. If you have any questions, you can email me at this email listed on the slide. And again, thank you for joining today.
Thank you, Patty, and thank you everyone for joining us today. If you have any questions, you can email them directly to Patty's email here. And at the end of today's presentation, there is a short survey to let us know what you thought of today's presentation. You will find out in the handout section, we do have a flyer for upcoming classes as well as today's printout. So thank you again for joining us and have a happy and healthy day. Thank you.